In this lesson, we will learn about erythropoiesis and destruction. Mainly study the following parts of content: the site of formation of red blood cells, the substances necessary for red blood cell production, regulation of erythropoiesis, and the destruction of red blood cells. Hematopoietic centers are different at a different stage of development. In the early stage of embryonic development, the hematopoietic stem cells on the embryonic yolk sac make blood. In the second month of the embryo, liver hematopoiesis begins, and then it goes to the spleen, and it starts to make blood. When embryo develops 4 to 5 months, liver and spleen hematopoiesis declines gradually. Marrow begins hematopoiesis and becomes the main place of hematopoiesis. After the baby is born, it depends entirely on the bone marrow to make blood. The bone marrow is the only place where red blood cells are produced in adults. When the body is damaged by some physical factors such as X-rays, gamma rays, and bends in chemical raw materials and some viruses, the hematopoiesis of the bone marrow is inhibited, and then the number and the quality of peripheral blood cells are decreased, which is called aplastic anemia. What do you need to make red blood cells? We know that the main component of red blood cell is hemoglobin, and protein and iron are important raw materials for synthesis of hemoglobin. Because red blood cells preferentially use amino acid in the body to make hemoglobin, anemia caused by a simple lack of protein is rare. The other necessary material is iron. Adults need 20 to 30 milligrams of iron a day for red blood cell production. 95% of that comes from the use of iron in your body, and the rest comes from your diet. It is important to note that most of ions in diet is travelent and need to be converted into divalent iron by the action of gastric acid before it can be absorbed. Therefore, when intake of ions is insufficient, absorption disorders or long-term chronic loss of blood so that the body is short of iron can lead to reduced hemoglobin synthesis, iron deficiency anemia. Iron deficiency anemia is characterized by decreased cell volume and low pigment, so it is also called low pigment small cellular anemia. It is the most common type anemia in clinic. Chronic bleeding disorders, pregnant women, and lactating women, as well as lack of stomach acid or iron deficiency in food, can cause iron deficiency anemia. Folic acid and vitamin B12 are important coenzymes for DNA synthesis, and folic acid needs to be converted into hydrofolic acid in the body. Folic acid conversion requires the participation of vitamin B12. A myeloblastic anemia characterized by decreased fluid available due to vitamin B12 deficiency or displacer of the nucleus and increase the erythrocyte volume. Erythropoietin is the main regulator of erythropoietin production. EPO mainly produced the proliferation of latent erythroid cell. It can also activate the expression of red line-specific genes such as hemoglobin. It also acts as a survival factor to inhibit the apoptosis of late erythroid progeny cells and promotes the nutrition and release of reticulocyte. Finally, achieve the goal of promoting the increase of red blood cell production. Kidney is the main site in erythropoietin production. Liver can also produce a small amount of erythropoietin. Hypoxia is the physiological stimulant to promote EPO secretion. Any cause of renal insufficiency, such as anemia, hypoxia, or decreased renal blood flow, may promote EPO synthesis and secretion, resulting in increased plasma EPO levels. Therefore, renal anemia is often caused by EPO deficiency in patients with advanced renal disease with severe damage to both renal parenchyma. In addition to EPO, androgen steroid hormone can also promote the production of red blood cells. And estrogen transforming growth factor, interferon, and so on can inhibit red blood cell generation. Androgen stimulates red blood cell production, while estrogen is inhibited, which is why adult women have fewer red blood cells and lower hemoglobin concentrations than adult men. The average lifespan of normal red blood cells is 120 days. Synthetic red blood cells are difficult to pass through the capillaries and are engulfed by macrophages, and the spleen is the main site of senescent red blood cells destruction. As a result of hypersplenism, damage to red blood cells by the spleen is intensified, leading to the splenic anemia. Another 10% of aging red blood cells are damaged by mechanical shocks in the blood vessels. The released HB binds to the plasma globulin and is ingested by liver. When a large number of red blood cells in the blood vessels are destroyed, beyond the binding capacity of the contact globulin, the hemoglobin that is not bound to the contact globulin is eliminated by kidney, and hemoglobinuria occurs. The following is a summary of this section, in which we have learned about erythropoiesis and its destruction. Normally, red blood cells production and its destruction are in a dynamic balance. Once the balance is broken, such as red blood cell production is reduced or destroyed too much, anemia will occur. When an inhibition of bone marrow hematopoiesis, there is aplastic anemia. The raw materials for red blood cell production are protein and iron. When the body is short of iron for various reasons, there will be iron deficiency anemia. Folic acid and vitamin B12 are essential factors for erythrocyte nutrition. And when deficiency, megaloblastic anemia occurs. EPO is an important factor regulating erythropoiesis, and renal anemia occurs when EPO secretion is reduced. The main site of red blood cell destruction is the spleen. When hypersplenism, there will be splenic anemia. That's the end of this section. Thank you for your listening.